The hospital to home service, which is run by Warwickshire Fire and Rescue Service, has been running for 3 years now, since 2018. It was launched to support the hospitals and the NHS because of the pressures they have with discharging patients, and it was a way that we could support through the fire service to get them people home safely, but then we tie in with them by carrying out that safe and well check.
When they picked me up from hospital, they were extremely kind because I was a bit emotional being in hospital for such a long time, and the day before I'd had a traumatic experience of a lady passing away in front of me. For me, it was quite an emotional day. The two people who helped me were so caring, and I just needed that on that particular day and on that particular hour, really.
The journey of a hospital to home visit first of all comes from the hospital to our service control, who are based at Leamington HQ, and from that they would contact one of the hospital to home team members, they would relay the information of who they need to pick up, what hospital and where their residence is, and then the hospital team would make their way to whichever hospital it is to basically pick that individual up, make sure that they feel comfortable, explain why the fire service are there and why we're taking them home that day. We would help them into our vehicle using different aids such as steps, hand grabs, swivel seats, anything to make them feel comfortable and to get into that vehicle safely.
When I left the hospital, the team took me to the vehicle that was going to bring me home, made sure that I got in without any trouble, put my bags in the back. They certainly took me in the house, stayed with us quite a while really. And when I got home, made sure that I was sitting somewhere nice and comfortable, and before they even started talking, are you all right? You know, make sure I was all right before they started chatting about other things.
And that's when we'd start to begin to carry out that safe and well check. And the safe and well check involves making sure that they've got working smoke alarms. If they haven't, we would fit some at that time, so we wouldn't leave it for another day. It'd be done at that time of that visit. And then we'd basically go through the safe and well, which incorporates questions around fire safety. So it's about use of candles, talking about evacuation plans, talking about a bedtime routine. So it's talking about all them elements to make sure they're safe and the prevention of fire.
And the gentleman went round and checked all the plugs in the house, made sure we got the correct plugs and everything. I mean, being in the house 30 years and we're elderly, sometimes you mend and make do. And so everything was double checked for us, so that was nice. They actually fitted us an extra alarm.
Because we've sort of got that partnership and that network with other agencies, we're able to then speak to them about other things, whether it's loneliness, whether it's they're struggling with their shopping, it could be they're struggling with perhaps mobility within the home. We're able to refer on to our partner agencies to get them further support that perhaps they didn't know or weren't aware of. So it sort of brings it straight back round to sort of support them in their own home so they feel safe, comfortable, and that they don't have that readmission into hospital, because they tend to go back in after a discharge because they may have a fall, or they're perhaps isolated, or they're not able to get their food or eat proper or anything like that.
When the team was leaving, they gave us this pack, and I feel our ages, 82 and 86, this is going to be most useful. If anyone else, my friends or anything, a lot of my friends live on their own, but if they were offered the service, I said, take it. You'd be reassured that everything's going to be fine, and you can ask them anything safety-wise, you'd be just fine.
This service works in partnership with Warwickshire County Council and the NHS, and to date we've taken home nearly 4,000 people.